welcome everyone to today's Synergist product demo webinar, SHOEBOX PureTest. I'm Kay Bechtold, Managing Editor of the Synergist, the magazine of AIHA. I'd like to thank everyone for joining us today, and especially SHOEBOX for sponsoring this webinar. Today's product demo is scheduled for 30 minutes, and we have a lot to cover, so I'm going to dive right in and quickly introduce today's speaker, Alexa Goff. Alexa is the Occupational Hearing Solutions Manager at SHOEBOX. In this role, she partners with employers and on-site and near-site occupational healthcare providers to find innovative ways of improving how they deliver audiometric testing as part of their hearing conservation programs, all while helping them achieve their overall business objectives. And now I'll turn the presentation over to Alexa.
Great, thanks, Kay. I'm just going to get my screen set up here. Wonderful. Well, thanks everyone for joining us today. Today I'm going to show you how, by leveraging technology to simplify and automate the testing process, you can make hearing testing affordable, easy, and enjoyable for your employees and your clients without the need for traditional equipment or outdated testing methods. What you see on the slide here is really the three most common pieces of feedback that I receive from businesses considering starting a hearing testing program, whether that be for their own employees or for their clients. It's too expensive. Equipment, software, training, costs can quickly add up. It's too difficult. I've never done this before. Am I qualified to perform hearing testing? It's too much work. Do I or does my team have the time to do this? Or will this overwhelm them and take away from their other responsibilities? Before we look ahead, though, I thought we would just take a minute to recap the last year we all just survived. No one is going to argue that 2020 was a tough year. As health and safety professionals, you've been on the front line of this pandemic. Your first priority has, I'm sure, and should always be the health and wellness of your employees, your clients, and yourself. I'm sure there are many of you that are attending this session today whose businesses were forced to suspend operations at some point. For others, maybe you had to change how your business operates. If yours is an essential service, you probably had to figure out how to maintain or even increase production levels while keeping the workplace safe for everyone. Whatever your situation, I'm sure that there have been considerable concerns about not only business viability, job security, but also employee health and safety. Over the past year, approximately 90% of Americans experienced some form of lockdown. More than 100,000 small businesses have closed up shop permanently. Supply chains have experienced intense disruption, and industries such as travel, tourism, automotive manufacturing, even oil and gas drilling, they've all experienced unprecedented drops in both demand and production. Not surprisingly, even if your business was deemed essential and remained open, it is quite likely that you put your hearing testing program on pause, at least for a period of time. In fact, this is exactly what OSHA recommended that you do. Earlier this year, OSHA issued an enforcement guidance, actually, which for the first time recognized that due to COVID-19, employers were not able to feasibly comply with a wide range of OSHA regulatory requirements. In the memorandum, OSHA instructed its compliance officers that they should exercise enforcement discretion and not issue citations for regulatory violations if employers made what's called a good faith effort, but ultimately could not comply with regulations requiring annual or recurring audits, reviews, training, or assessments. These guidelines actually remain in effect today, but as businesses start to open back up, hearing testing is once again becoming a priority for many places of work where employees are exposed to noise. You may be anxious to begin testing, and that is understandable. You may also still see it as less of a priority than other safety programs. Again, understandable considering the circumstances. But for those of you who are ready to begin testing, we want to help you create a plan in place that ensures both safety and compliance before you start. And let's talk about how to do that now. So how can you get your hearing testing program up and running in this new normal? Of course, while still remaining compliant and observing OSHA's recommendations. For employers who are used to outsourcing their testing program to a third party, the first challenge will be finding an available service provider who can come on site to administer testing. Most or many service providers have, let's call it a healthy backlog of postponed clients who are waiting to get back into the queue. And employers who didn't reschedule their annual testing, perhaps when their state went into lockdown, they could experience delays of several weeks, even months. For service providers, primary consideration is likely how to offer hearing testing to your clients while still remaining compliant and profitable. Physical distancing protocols mean that it's likely fewer people will be tested simultaneously. Booth spacing needs to be staggered. Additional time is likely required to clean, disinfect, and ventilate the booths between each test. All of this adds up to more time spent at each client location, which significantly impacts your margins and potentially means higher fees for your customers. Your number one priority is the health and safety of your employees and your clients. Once you decide that you're ready to begin your testing program, your customers or employees may have concerns about having their hearing tested, particularly if testing is being offered in a traditional setting, like a sound booth or a mobile clinic. Your customers or your employees may be wondering, who was in the booth right before me? Will I have access to PPE before entering the booth? How much space is there between booths or between me and the test administrator? These are all valid questions. To answer these questions and the many other questions you're likely to receive, as well as just to find more information about how to develop a safe and compliant hearing testing program, the best place to start is always OSHA. According to OSHA guidelines, employers should adapt infection control strategies based on a thorough hazard assessment using appropriate combinations of engineering and administrative controls, safe work practices, and personal protective equipment, or PPE, to prevent worker exposures. Now, although sound booths have never really been an optimal testing environment for the person having their hearing tested for many reasons, it's important to remember that your customers or employees may ask more questions now, or even refuse to be tested in a booth altogether because they have concerns about the measures that are being taken to protect them from contracting COVID-19. It's really up to you to provide them with a safe environment for testing and reassure them that their health and safety remain your number one priority throughout the testing process. Okay, here's where I tell you that there is a better way to offer testing, one that doesn't involve a sound booth and that ensures the safety and comfort of your employees and customers. SHOEBOX Audiometry was purpose-built for out-of-booth testing. We've helped hundreds of employers bring their hearing testing programs in-house, and we have also worked with an equal number of service providers, enabling them to offer hearing testing services to clients across North America thanks to our simple, all-in-one solution. Testing with SHOEBOX couldn't be easier. We provide all the tools you need to get started quickly and efficiently. But SHOEBOX is so much more than just testing equipment. We also offer a wide variety of services as well. Our unique business model allows us to deliver our solution to our customers in an entirely remote fashion. All of the testing equipment is calibrated and shipped directly from our corporate office. Training for our customers is delivered virtually and can be recorded to share with others in your organization at a later date. Real-time reporting and data analysis features are available to customers on demand via our cloud-based data management portal. And all of our audiological services, from program supervision by our KAOC-certified audiologists to audiogram review delivered by our nationwide network of regionally licensed audiologists, is done virtually. SHOEBOX also provides advantages from an infection control standpoint as well. First off, there are only two main pieces of equipment that require sanitization in between testing: the iPad and the headphones. Of course, we want to be conscious as well of disinfecting and sanitizing any surfaces used in the testing process. Clorox or Lysol wipes can be used to disinfect the iPad in between tests, and then non-alcohol-based audiological wipes should be used for cleaning the headphones. Hydrogen peroxide is another option that works well for disinfecting the headphones between each use. SHOEBOX also simplifies at-distance testing. Once the test has been initiated, simply hand the iPad over to the person being tested and allow the system itself to guide the employee or the patient through the testing workflow. With SHOEBOX, it's easy for the test examiner and the subject to remain at least 6 feet apart from one another throughout the entire testing process. Aside from the advantages that SHOEBOX offers from a safety standpoint, there are a number of other reasons why our customers love our systems. Here's just a few. It's fast and simple to get started. No special certification is required to test with SHOEBOX. We provide training to all of our customers and enable teams to feel confident testing in the field, even if they've never administered hearing tests before. With SHOEBOX, scheduling is so much simpler. Moving to a rolling schedule of testing with SHOEBOX means no more need to cram all of your testing into a once per year window, and also no more missed new hire tests. Test when it makes sense for your business and ensure that your compliance rates remain high throughout the year. Our active noise monitoring system uses an external Class 2 microphone to assess ambient noise levels while testing is being performed, which ensures that you are always testing in an OSHA-compliant environment. And our data management system makes it simple to analyze results and generate reports in real time, which means no more paper records. Finally, and this is important, employees or the people being tested, they simply like it better. SHOEBOX creates a better testing experience than the one administered from the back of a truck in a cramped, stuffy, and potentially unsafe sound booth. This last point has really become even more important in recent months, and we don't really see that changing anytime soon. On this slide, what we're showing is a very brief overview of how we deliver our solutions to our customers. I won't go into great detail here. Safe to say that when you choose to test with SHOEBOX, we walk you through every step of the testing process, also through the reporting process, of course, to ensure that your program is a success. We work hard to understand your business's unique requirements and provide resources that help you run a successful program. Whether you're an employer, looking to bring their testing program in-house, or a service provider offering testing services to your clients. As mentioned previously, earlier in the presentation, the SHOEBOX solution really isn't limited to audiometric equipment and reporting software. We also offer a wide range of support and audiological services, which allow us to assist our customers in developing and maintaining hearing testing programs that are both compliant but also cost-effective and efficient. Because we're a software-based system, our solution is always evolving and improving based on the feedback that we receive from our customers. And finally, we're proud to be able to enable our customers to operate more sustainable testing programs by eliminating the need for paper-based record-keeping systems. Okay, so I'm now going to walk you through a very brief 4-minute demonstration of SHOEBOX PureTest. This is a very brief and fast-moving demonstration, so try to keep up. For anyone wishing, though, to see a complete demonstration of the PureTest system, please feel free to contact us after this webinar. My contact details will be listed in the final slide. Let's start on the web portal side of the system. First up, test prep. So the frequency of daily activities, such as verifying room noise and checking the calibration of the device, can be controlled from our portal. From the portal, you can also choose to block testing, for example, if test prep tasks are not performed. Test workflows can be created to guide the employee through the testing process seamlessly, and you can customize workflows to your program, but we have also put in defaults to comply with OSHA or MSHA protocols. From the portal, you can also customize the report that the employee and test examiner will sign off on, including whether or not to overlay the baseline and hearing grades, as well as being able to modify the language on the report being delivered to the employee following the test. PureTest gives you the ability to perform fully offline testing. By selecting offline testing, the system will save the employee demographics and baselines so that a shift analysis can be performed regardless of whether or not you're connected to a network. Moving over now to the PureTest application. The new PureTest application has been refined with the health and safety professional in mind. The icons in the top left will give you quick access to view your data connectivity, view any unsynced results, and pull down updates to your employees flagged for offline testing. To begin, search for an employee to test. Here we've selected John Doe, but I receive a warning that I've not completed the required activities to ensure my device is working. This will remind me to head back over to the test prep section to complete those tasks. First, we'll do a room scan with our calibrated microphone. This functions like a sound level meter and assesses if my room is appropriate to test in. Next, we'll verify the headphones are working. If there is any crackling or static in the sound presented, I'll mark this as a fail and can contact the SHOEBOX support team to troubleshoot. If it passes, I'm ready to get started. Now I'll head back to the search bar and pull up the employee I'm ready to test. If the demographics are accurate, I'm ready to start testing. The employee is presented with a view of what test prep tasks there are to complete. Once they select Start Questionnaire, they'll be brought through a 21-question hearing conservation survey. Once that is complete, they can begin the hearing test. They are first presented with instructions on how to perform the test. Then the employee will complete the clinically validated automated self-test. If all was completed successfully, they will be notified by the green check marks. If there were any issues with the test, they will be notified and can retest any frequencies required. Our software also pauses if ambient noise exceeds the OSHA M panels. The examiner will be prompted to type in their passcode to review the results. This page is a condensed summary that shows the current audiogram baseline and whether a shift is present. There are automated notes based on the presence or absence of a shift, and the employee and examiner can then sign off on this document. This document can be shared at the time of testing by print or by password-protected email. It will also be synced and viewable immediately in the HIPAA-compliant SHOEBOX web portal. Once complete, the examiner is returned to the home page to search for the next employee to test. So to recap, a few key points. SHOEBOX will help you save money, as well as help you expand the services you offer to your clients without the high cost of traditional equipment like trucks, booths, and maintenance for those pieces of equipment. We will help you train your team to administer hearing tests, even if they've never done this before. You'll deliver an optimal experience for your clients, for your customers, whether that be your employees or the customers that you provide services to, and you can be confident that compliance requirements will always be met. That's all for me today. Thank you for your time, and I'll pass the floor back to Kay.
Okay, thanks, Alexa. It looks like we have about 8 minutes left for questions. Just a reminder, if you'd like to ask a question, please type it into the chat window on the right side of your screen and send to everyone or all panelists. Alexa, the first question I have for you is how can I test while minimizing risk for my employees?
Yeah, sure. Great question. So many things can be done to address concerns about, say, infection control during hearing testing. Aspects that should be considered, include human contact, surface contact, air quality of the testing environment. We certainly recommend that you adhere to your organization's infection control policies as they relate to, say, surface cleaning or human contact. A couple of things that we can certainly mention. I mentioned, basic things like Lysol or Clorox wipes can be used to sanitize the SHOEBOX equipment, the iPad, and so forth. And certainly those can be used on surfaces as well. Alcohol should actually not be used as a cleaning agent on the headphones themselves, as it's quite damaging. So alternatives such as hydrogen peroxide can still accomplish that disinfecting task without damaging the equipment. I would say that really a great resource to look towards for answers in this area would be the NHCA's or the National Hearing Conservation Association's best practices guide on hearing testing during the COVID-19 pandemic. And that can be easily found on their website. But I would say all of those things. Other things would be, of course, maintaining a physical distance. So one of the great aspects of SHOEBOX is that we make it simple and easy to maintain that 6 feet of distance between the examiner and the person having their hearing tested. So physical distancing, of course, also a major factor here. And then, as I mentioned, easy ways to sanitize both the surfaces and the equipment itself between each test offered.
Okay, great. Thank you. The next question I have is, does SHOEBOX have infection control specific recommendations for testing with an iPad-based audiometer?
We do have SHOEBOX specific recommendations. We actually put together a guide for SHOEBOX users that can be easily found on our website just by going to shoebox.md and then searching infection control. Some of this will overlap with our general recommendations. So first things first, I would say when selecting a room for testing, make sure it's a room that, of course, is going to allow you to meet the OSHA M panel requirements for noise, so not a massive room, But you do want to make sure it's a space that allows you to maintain that 6 feet of distance between the examiner and the patient. Again, coming back to the importance of disinfecting and sanitizing all equipment and testing surfaces in between each test that is offered. I know it seems simple, but just these Lysol or Clorox wipes are what we recommend for the iPad itself, and then any surfaces in the testing station. And then there's actually single-use disposable, I'm going to back up. Lysol or Clorox wipes for the surfaces, and the iPad, hydrogen peroxide based wipes for the headphones to avoid any damage. And then there's also another thing you can use is single-use or disposable earphone covers that can also help prevent contact between skin and surface. So it really comes down to maintaining physical distance, which SHOEBOX certainly enables you to do, and then ensuring that between each test provided, the proper sanitization and disinfecting protocols are followed.
Okay, great. Thank you. The next question I have, someone says, I really like my current service provider, but I'm nervous about the truck. Could they use SHOEBOX instead?
Absolutely. The answer is absolutely. I mentioned briefly during the presentation that we work with both employers and service providers. It's almost a 50-50 split, in fact. So we've helped hundreds of service providers offer testing services to employers across North America. I think, one of the benefits to the service provider is certainly the fact that our solution's lightweight, portable, doesn't require an internet connection to test or report, easy to get started, up and running quickly, and certainly cost effective. So I would say the best thing to do would be to point service provider towards shoebox.md. From there, they can inquire about what it requires, learn more about what it requires to get started. Typically, it's a fairly quick turnaround time. So in a matter of weeks, we can get you your systems, get you trained, and have you up and running efficiently to provide testing.
Okay, great. The next question I have is, what if everything shuts down again due to the pandemic? How will that affect SHOEBOX in their offerings? Would SHOEBOX shut down as well?
Yeah, that's a good question. I wish we weren't still answering these questions, but you never know what the next few months will bring. What I can say is that as the makers of a medical device, we have actually been able to continue operating throughout the pandemic and assisting our customers with operating their programs in safe, effective, and compliant ways. The majority of our team is currently still working from home, with the exception of a few essential teams that are in our office. If things do shut down again, that will not impact our customers' ability to purchase SHOEBOX systems to then perform testing for their people. It really won't impact us. And I would stress that one of the key pieces of feedback we've received from our customers over the past year is that they went with SHOEBOX because we were able to facilitate safe testing protocols, considering, or all things considered. So they actually went with us because we were the safer option. That will not change regardless of what takes place over the coming months.
Okay, great. Thank you, Alexa. Unfortunately, that's all the time we have for today. I just wanted to let everyone know that we'll share all questions from today's event with SHOEBOX. So if we didn't get to your question, please know that they'll reach out to you directly. I wanted to give my thanks to Alexa Goff for her presentation, to SHOEBOX for sponsoring today's webinar, and to all of our participants. Please keep an eye out for announcements of future Synergist webinars.
Thanks, everyone.
All right. Thank you all so much. This was great. This actually concludes today's webcast. Thank you all for attending. The recording will be available at aiha.webvent.tv. We will send all registrants an email tomorrow with this link. And please visit our event calendar to sign up for future webcasts.